Welcome, everyone. We're so glad to have you here this afternoon. I'm Gail Tudor, the board president for the New Hampshire Public Health Association. This is the 6th annual Team Up Take Action conference, and it's been put together by a volunteer group from both the Vermont and the New Hampshire Public Health Association. Next slide. Just to try to keep a group as friendly as we can. Just note, if your name does not appear on the screen with your picture, please just click on the 3 dots in the upper right-hand corner there and put your name there. So it'll seem friendly. This is particularly important for the breakout groups. And next. So we just like to say thank you to our New Hampshire sponsors. And I'm not going to read them all out, but you can see them there. And next. And thank you also to Vermont sponsors. All righty, next. Okay, so today we have 2 exciting keynote speakers, and then they'll be followed by breakout groups, and then we're going to come back together and have a short session where we'll poll you for some reactions to the presentations, and then we'll summarize the presentations and breakout group discussions. But before we get this started, I have just a few housekeeping issues to cover. So you should be muted as you entered. If you're not muted, please mute yourself to avoid any unwanted noises while other people speak. Your controls are at the bottom of your screen. You'll see a chat box there. So if you have questions, or particularly if you have questions you would like to be asked of the key speakers at the end of their presentations, please type it into the chat box. And make sure in the chat box, the bubble says to everyone, so everyone sees the question. We have enabled the audio transcription, so the meeting can be live captioned. We are recording the keynote speakers and the Q&A to follow, but nothing else will be recorded. And I just want to remind everyone that you do have your own control of what you see on the screen throughout the afternoon. So if you click view on the upper right of your screen, you can choose whether you just want to see the slides or whether you want to see the slides and just the speaker, or whether you want to see the slides and a bunch of people's faces. That is up to you through your view option. And that will not affect anyone else. Okay, did I cover it all? I believe so. Okay, next. So I'm going to introduce our first speaker today. We will have our first speaker speak for about 20 minutes. Then we will introduce our second speaker who will speak. And then after they both completed, we will have our Q&A. So, okay, so we are ready to start recording, though I think you already started it. So our first speaker is Patricia Tilley, the director of the New Hampshire Division of Public Health Services. She leads a dynamic organization responsible for fostering systemic approaches to promote health and well-being, preventing chronic conditions and infectious disease, reducing health inequities across the lifespan, and preventing premature death, disease, and disability from environmental causes. For more than 20 years, Patricia has provided leadership in maternal and child health and population health, and has had the privilege of partnering with policymakers, healthcare providers, community-based supports, advocacy organizations, and businesses throughout the Granite State to strengthen the safety net supports and improve health and wellness outcomes for the people of New Hampshire. So welcome, Tricia, and please kick us off.
Thank you so much. I've got to put my timer on now so I don't go over my allotted time. And now, and again, thank you for that kind welcome. Now is the part that is every presenter's worry, where I'm going to try and share my screen. So let's do that quickly. Well, thank you so much again for that very kind welcome. It's such a pleasure to be here with friends and colleagues from folks on both sides of the river. So today, during our time together, we're going to take a look at a couple of things. Whoops, I just flipped I moved so fast that I moved my screen the wrong way. So here's what we're going to do during our time together. I could spend hours talking with this group of friends, but our time is limited. So I'm going to focus on three main areas. I'm going to focus a little bit on the health disparities that have been laid bare by this pandemic. I'm going to focus a little bit on some of our strengths and weaknesses of our public health system in New Hampshire. And I'm going to give you just a very short sneak preview of some of the places and some of the things that we're going to next. But to start, before we really dig in, I'm going to share that over the pandemic, I have found myself switching from listening to NHPR on my ride home late at night to country music. This is a big transition for me. I was sort of a wannabe punk rocker back in the day, and now I'm all of a sudden listening to country music on that ride home. But the thing that has really just about sucked me in recently as I was preparing for this presentation is this song with this lyric right here: around the house, don't fall when the bones are good. I will spare you from my singing of that. But if you know that song from pop radio, from country pop radio, I will now invest that earworm into your ear, and you can have it going through your head as we go through the following slides today, because it really speaks to the foundational nature of what we're working on right now. That if anything we've learned during the pandemic is that we need a strong foundation. And only with that strong foundation can we be prepared to tackle the challenges that we faced and the challenges we're going to face in the future. So let's start at the very beginning. Here's where we were before the pandemic. You know, we knew that we have had this burden of chronic disease in the state of New Hampshire, as well as throughout the country. And I'm just looking for my notes now. And so, as I said, just like the rest of the country, we have felt that marginalized and historically excluded populations have been disproportionately affected by chronic disease and other burdens for all of the reasons that those of us together have either lived or know. We have heart disease, we have cancer, we have diabetes, and we know this. And while we know that that burden exists in our communities of color, we also know that there are other marginalized groups, such as the LGBTQIA community, that have also seen higher rates of some of these same conditions. And what we know is that this has made us vulnerable to the worst effects of COVID, which is exactly what we saw, especially in the early days of the pandemic. Hospitalizations around the country were higher among communities of color. And, you know, none of this is new information to us. Even in New Hampshire, even the media is unable to unsee the disparities and cracks in our foundation. Our vulnerabilities were laid bare. And even with our best plans for mitigation, there were disparities in cases of COVID, hospitalizations, and access to vaccine. Our New Hampshire case rates bore this out. Granite staters who are not white had higher rates of COVID since the very beginning, and those slopes are getting farther apart. Some of our data has suggested that we're vaccinating non-white residents at a higher rate, though, than some of our white residents, but there are complicating factors at play. That data is not inclusive of all long-term care facilities that skew older and whiter, and we have not been able to capture all of our pharmacy data in New Hampshire. This has been in the news right now of the complexities of data. And that also may tilt that towards a greater proportion of white residents being vaccinated than our communities of color. When we look at vaccine uptake geographically and with social vulnerabilities, and this analysis was done by FEMA and the army of engineers, we see another foundational and long-known challenge for New Hampshire. Coos County and other rural communities have lower vaccination rates and more intensive social vulnerabilities, such as household members with a disability and insufficient housing and transportation. Then let's look at the kids. We have had almost double the number of school-based clusters from August through early November of this year than we did in the entire school year last year. Of course, the return to in-person learning plays an enormous role in this, as well as the individual policies and mitigation strategies that schools have chosen to implement or not implement. And what that means in a practical sense is that children, many of whom have not yet had the opportunity to be vaccinated, now account for 88% of the people impacted by school clusters, as opposed to only 67% from last year. So we've got vaccine, and we know that it is our turn. This is our shot to get back to normal now. Yet I'd like us to consider that normal wasn't quite good enough. We know that in normal times, we already had these broad health disparities. And unless we actually address those systemic issues of differential treatment, access to quality care, and fundamentally building trust, we are going to land right back where we started. And, it's not all just about case rates and vaccine, or even chronic disease for that matter. Our new normal will also have to grapple with complex issues that impact our wellness. As part of our planning for our New Hampshire State Health Assessment, we recently ran a poll on the Granite State panel, and New Hampshire residents had some wide-ranging responses about their loneliness and isolation. While Coos, we saw earlier, has some vulnerabilities, they actually don't appear to be that lonely. Latino residents had greater proportion of people who felt alone. And perhaps most interesting was that even with the isolation that older adults experienced during the pandemic, that population did not express this as much of a concern. This isolation was felt much more keenly by younger adults in those younger age cohorts. Meanwhile, this is what people in New Hampshire want us to prioritize. These same panelists let us know that what they think the state should be focusing on, and their priorities were pretty clear, were the things that are most important to the foundation of our health. It wasn't health specific, but it was education, positive childhood experiences, access to great health care, meaningful work, and the supports for mental and behavioral health. So we all know and have all had questions about whether our infrastructure is ready to take this on, or was it even ever ready in the first place? Does our infrastructure really address our health disparities? Well, we all know that New Hampshire and Vermont consistently are ranked as great places to live with healthy residents, but those of us in the field have known that this foundation is a little shaky. We've all heard the rallying cry that persistent disinvestment in public health has limited our ability to effectively respond to COVID and other crises. There's a severe shortage of public health workers, and the deficits are growing due to the high turnover rates, the stress of the past 20 months, and losing our workers to retirement. If you need a new job, let me and Dr. Levine know, because we probably have 20 that meet your interests right now. The unpredictable and reactionary nature of funding has never allowed for the stable building of a robust public health infrastructure or workforce that can engage in health protection and promotion in ways that actually reduce healthcare utilization, improve quality of life, while also being ready to respond to urgent demands, such as the current pandemic. We've done good work under less than ideal circumstances, but we know that the system has been and always has been under pressure. So how do we build a future in which we are all protected from threats to our health and well-being? Well, we need to fix the foundation. We need to focus on the people who do the work and the diverse communities we serve. We need to give our people better tools to do their job. We need communication that leads to trust. And we must also consider that while new funding is sorely needed, we simply cannot fund our way out of the conundrum we face. It is our communities are becoming increasingly hostile to public health intervention. And so we need to find new ways to communicate with the public and also engage in partnerships at every single level. So we've got some plans. You know, like all good health departments and all good public health workers, we love a good plan. And so we have some approaches now that we are thinking about in order to reduce health disparities. We are looking at funding and supporting those fundamental organizations within our communities, our rural hospitals, our family resource centers, our organizations that are trusted within the community, whether those are community organizations of BIPOC communities or even organizations like the New Hampshire Public Health Association. We are working on really new areas for New Hampshire, things like transportation, partnering closely with the Department of Transportation, partnering closely with the Department of Safety, looking at things like EMS and making sure that we have paramedicine available in every corner of the state. Things like our early childhood initiatives, ensuring that folks have access to home visiting, to family resource centers, and community supports. We're also going to be asking our public health networks, our fundamental foundation within our communities, to start thinking about equity in new ways, developing new equity plans that will assess and identify the needs specific to marginalized or historically excluded populations. And so all of this comes with this new influx of money, and it really provides an opportunity to start building back that foundation in a much stronger and holistic way than we ever have before. But you know, we all know that government cannot do this alone. The key to our success has been the focus on making connections. We are all deeply indebted to our healthcare community over the past 20 months. They have handled the burden with grace and shown us all what leadership really looks like, but also out in our communities, home visitors, family resource centers, staff at WIC programs have innovated, used new technology to meet families literally where they were and connect them and to their communities and to the supports they needed. Home visitors and community health workers and school nurses have been some of the other unsung heroes of this pandemic. They know that our families best, and they are the trusted members of the community, and we need more of them. So back to my earlier point, if you need a job, just let us know, because we're going to find you one out there. These folks out in the community right now are debunking misinformation. They know that if we don't address the root causes of health disparities, those cracks in that foundation are just going to keep widening. Some of the other things that I'm most proud of is the way in which our New Hampshire team, our public health folks, have made time available to talk directly with healthcare providers out on the front lines, school nurses who are working every day in our schools, with childcare providers, with business owners. And I really think that that's part of what makes New Hampshire great. I think half the state has my cell phone number and the numbers of my team, and no one is afraid to call or text a question or seek some guidance along the way.
5-minute warning.
Great, because I'm on my last slide. And since this is a keynote address and Dr. Levine is certainly going to have more impressive information to share, and he's going to be able to share his slides in a much more graceful way than I did, my job is just to leave us hopeful. And there was no one more hopeful to me than the acclaimed poet, Amanda Gorman. I think her words ring true as we work together to rebuild our foundation. As we and public health join together to finish the work that we have started, to envision communities, states, and a country in which all people have an equal access and equal opportunity to be their best selves, to grow in their optimal health and wellness. So I will leave you there and I will stop my screen share because I'm better at that than I am pulling the slides up. So thank you.